Another young child below the age of 12 has died after contracting COVID-19, making her the second such death in Singapore. According to the Health Ministry, the 4-year-old girl died from pneumonia on Sunday, July the 17th. She had no past medical history and was previously well. On the 15th, she had developed symptoms of an upper respiratory tract infection and fever. 2 days later, on the 17th, she tested positive for COVID-19 via ART at a GP clinic. She was prescribed medications for her symptoms but remained unwell and collapsed later that night. If you recall, on June 27th, the ministry reported that an 18-month-old boy died from encephalitis due to COVID-19 and 2 other viruses. Paediatrician Dr. Lim Yang Chern joins me now. He's from Thomson Paediatric Centre. So, Dr. Lim, in this case, the child died from COVID-19 pneumonia. So, what is COVID-19 pneumonia?
COVID-19 pneumonia is just like any other pneumonia. The etiological agent is just due to the COVID-19 virus. A lot of times there may be co-infections found there as well that may not have been released. But I think the predominant concern in this case was probably COVID-19. COVID-19 pneumonia is actually not a very common complication. Often it occurs in around 5% of cases of COVID. And of that 5%, probably less than 1% actually get a severe element of pneumonia causing that can lead to death.
I see. Well, Dr. Lim, then what are the signs of pneumonia in kids? Do they have the same symptoms as adults?
So I think you have to break it down a little bit by age. So in general, for children above 12 years of age, their symptoms are going to be very similar to the adults. These children are older, they are able to verbalize their complaints. So they are able to tell you, they've got fever, they've got cough, they feel that it's difficult to breathe. And you can also sometimes observe that their work of breathing may be increased. However, for the younger age group, especially for the infants and the pre-verbal age group, it can be a bit difficult because they're unable to tell you. All you can see is that the child is having fever and the child is coughing. So I think one useful indicator for young children is actually whether or not they're able to feed normally. So with pneumonia, you have you've got increased fluid and gunk in your lungs, and this reduces the amount of air exchange in the lungs. And as a result, you need to increase your rate of breathing and your work of breathing to compensate for that. So in children, this will manifest as really poor feeding. They get tired very easily. Let's say, for example, they drink 60 ml of milk, it usually takes them 5 minutes. Now you have to break it up into 3 or 4 times because they just get tired out. So that may be a sign of respiratory distress, and that may indicate a chest infection like pneumonia. For toddlers, however, it's a mixed bag. They have a little bit of both. They are verbal, but sometimes not very reliable historians. So I think a high index of suspicion. I think it's very useful for parents to look at their breathing. So often I ask parents to maybe open up, expose their chest and see how the chest wall is moving when they're breathing. If you find that they're having very deep sort of recessions or deep seesawing movements of the abdominal wall over the chest wall, that may be a sign that it's very labored breathing, and that may be a sign of things like a pneumonia. So these are things that I would say watch out for in children with these symptoms.
Well, Dr. Lim, just to bring in the previous incident of the toddler dying of encephalitis last month, while you said encephalitis is rare in children, how common is pneumonia that could result in death?
So I think pneumonia in itself, viral pneumonia and COVID-19 pneumonia or in general pneumonia is not that uncommon. We see that quite commonly in our practice. Around 5% of cases are pneumonia in terms of a respiratory infection, but severe pneumonia that can lead to death, that's quite rare. So in general, I think that the most common presentation of COVID-19 in children by far and large is still a self-limiting upper respiratory tract illness. Small percentage, like up to 5%, can get a chest infection, a pneumonia due to the COVID, but the severe ones are even a smaller proportion of that. So I think we must remember that this is a reflection of the number of cases we see. So as the number of cases of COVID-19 in children increase, the denominator increases, so the number of cases of severe outcomes will naturally go up a little bit. The rate doesn't change, the percentage rate doesn't change, but because the numbers are just rising, we're going to see possibly more and more severe complications arising from that.
Thanks for watching. Be sure to subscribe to the channel and hit the bell icon to be notified of new videos.